Okay, welcome everybody. It's Ruth Goldstein here. I am the Assistant Director of Public Health for Cornwall and the Isles of Scilly. And we're doing one of our quite regular now Facebook Lives. We try to do these when we really want to help anybody in our population understand any of our sort of health or public health issues, and actually try to help everybody take the right steps to keep themselves healthy and well. Some of you over the last few months may have been hearing about measles, which is a quite unusual, it's not unusual, it's unusual now, but it didn't used to be unusual. But it is an illness, a disease, which is very easy to pass between one another. And something certainly when I was a child, which was a very, very, very long time ago, we always used to get measles because we didn't have a way of stopping it. And some of you will have heard and read things in the news and newspapers and internet about measles on the rise. And so we thought it was really worthwhile doing this Facebook Live so that we can kind of get rid of some of the myths and mysteries about measles and help you all understand exactly what you need to do to keep yourselves and your families and your friends safe and well. Before I get into what measles is about, I'd like to introduce my panel of experts. I'm really grateful to everybody for giving us their time. So Dr. Garman, John, can you just introduce yourself first and say a little bit about why you're here and want to talk about measles?
Yeah, of course. So my name's John Garman. I'm a GP, senior partner in Helios Health Partnership, which is down in Helston and actually on the Isles of Scilly as well. So from my perspective, this is really about making sure we can get as big an uptake of measles vaccination as possible, just so that actually, if and when it does come to Cornwall, we are prepared and we don't see some of the problems that we've had with other sort of infections that can spread quite quickly, particularly in the younger age groups.
Thank you, John. Michele, do you want to introduce yourself and explain maybe what your job is, because people might be interested in that?
Hi, I'm Michele Boyce. I am a service lead nurse for Kernow Health, but as part of the contract we deliver with Kernow Health is the school age immunisation programme for Cornwall. So we attend every school to do the immunisations from primary to secondary school age, and that's also including the home educated population as well, cohort of children. We're recently targeting year 8 children that are incomplete with their MMR vaccinations as well.
Brilliant. Okay, so anybody who's got children at school who have been part of a school-aged immunisation programme, no matter what it's for, may well have had Michele putting needles into your children's arms to keep them safe. So thank you, Michele, for that. And Emma, can you introduce yourself, please?
Yeah, sure. So my name's Emma McMaster, and I'm an advanced public health practitioner at Cornwall Council for Health Protection. So looking at population health and looking at how we can increase uptake for MMR across Cornwall.
Brilliant. Thank you, Emma. I have to say, Emma is my right-hand woman on this and knows far more than I do about what advertising is going on, what the situation is in Cornwall. So I rely on Emma a lot to keep me informed. Okay, I thought we'd just start by talking about what measles actually is and what people might see on their family and friends if they have managed to catch measles. Because, as I said, when I was a child, sort of 50 years ago, a lot of people got measles, and it was a fairly nasty infection which laid people up for sort of 5 to 7 days, made you feel quite unwell. But since we've had a really good vaccination programme, a lot of people will never have seen measles, won't have even heard about it. The vaccination you have to stop you getting measles is the MMR, and that stands for measles, mumps and rubella. So it's a vaccine that we give to children twice, and it keeps them safe from those 3 infections. So if people have had that vaccine, then they will not catch measles. But, and we'll talk about this in a little while, unfortunately, not everybody's had those vaccines, and we're starting to see cases of measles. So, John, can you just kind of tell us what measles looks like in somebody, and maybe what people should be looking out for?
Yeah, of course. So yeah, I mean, measles is a viral infection. As Ruth says, it used to be really quite common. Actually, fortunately, these days it's pretty uncommon. So we rarely see it, but when we do see it, it tends to crop up in sort of, a number of cases because it is really quite contagious. So if you come into contact with someone with measles and you're not vaccinated, depending on where they are in the illness, there is a reasonable chance that it can be spread on. And obviously in the age groups that we particularly worry about with the children, they're all in very close contact in schools and nurseries, and so actually this can spread like wildfire in an unvaccinated population. So it tends to start with, I guess, similar kind of symptoms to a lot of the viral infections. So it will be things like a fever. You can often have a cough with it, lethargy and malaise. So just feeling unwell, poorly, runny nose, what we call coryza. You can have a bit of diarrhea with it. So a lot of the common type of symptoms that we see with viral infections. But what you then get is this very typical rash, and it can often start on the head or on the abdomen or on the thorax. So it starts in one place, but it very quickly spreads to become, really very widespread. Sort of, it's quite a red. It looks quite angry. I mean, actually, it's not the rash itself that's the concern. It's more the ongoing sort of viral illness underneath it. But it looks very distinctive and it looks very angry when you see it. So I guess really the time to think about going to see a doctor, if you haven't, if either your child or whoever is not getting better with the usual sort of self-care that we advise for a virus, and particularly if they get a very rapidly spreading sort of red rash, then that's maybe the time to go and see somebody, or at least get some advice. I guess it's worth saying about why we worry about measles in particular, in that, as I said before, it can spread very rapidly, and so you can see quite a few cases very quickly, but it's more about the risk around complications of the measles. So with any viral infection, you can get things like dehydration, and particularly if there's some diarrhea with it, which you can get with measles. So young kids in particular, or some of the more unwell or frail people might get more unwell with dehydration. But there are a few very specific infections that you can get, or complications rather, I should say. So you can get some ear infections with it that can be quite difficult to treat, because it's a viral infection as opposed to a bacterial infection. But the ones that we really worry about are there's a pneumonia that can follow with it, and you can get really quite unwell. And there's a rare complication called encephalitis, which is where you can actually get some swelling of the brain with it. And those are the ones that we really worry about. But obviously, in order to stop those, we need to get as many people vaccinated as possible. I guess it's worth pointing out that actually, if you have got measles, the chances of I guess being unwell enough to end up in hospital are really quite high with this. So I think it's about 1 in 5 will end up in hospital with measles. So there's a little bit about how unwell you are as an individual, but there's also a little bit about kind of protecting the rest of the population with it as well. So yeah,
Brilliant.
That's a brief overview.
Yeah, no, thank you. I think that's really good. Emma, I know that you've been sort of following what's been happening in other parts of the country. Do you want to just give a little bit of an oversight about where we've got a lot of cases in the country, and maybe just about the hospitalizations, just in general about what's happening in those areas?
Yeah, sure. So we know at the moment that our largest outbreaks are in London and in the West Midlands around Birmingham, where we are seeing cases in the hundreds. We also know that we're starting to see cases in the southwest as well, where there have been a smaller number of cases around Bristol. And I just think the important thing to know here is that measles, as Dr. Garman's already said, is highly, highly infectious. And we do have, people who are unvaccinated here in Cornwall, and wherever there are people unvaccinated, then measles will sadly spread. And it's only a matter of time, is the advice that we're being given regionally, that we would expect it to start spreading further across England. So I think with people just moving around generally in their day-to-day lives, and visiting other places, that it wouldn't be entirely unexpected if we were to start seeing some cases here in Cornwall as well.
Brilliant, thank you. I know I've been sort of in various meetings hearing about what's been going on in the West Midlands and particularly around Birmingham and Birmingham Children's Hospitals, hearing some reports from there about how unwell the children actually are and how much of an impact that's had on Birmingham Children's Hospital's ability to cope. And if we think that 1 in 5 of every child, of every measles case is probably going to end up in hospital, that's really meant that sort of 40, 50 children have had to be admitted to Birmingham Children's Hospital over the last sort of 3 months. So it is very real, unfortunately, and we are seeing it in unvaccinated children, particularly. Michele, you go around vaccinating children. Have you noticed over the last sort of few years that even in Cornwall you're giving less and less vaccines that generally than we have done in the past?
Absolutely, yeah, I totally couldn't agree more. We don't know, we don't know whether it's vaccine hesitancy, whether it was vaccine fatigue, because poor parents during the COVID time, they were being inundated by please consent for your child to receive up to 6 vaccines in 1 year. So yeah, we just don't know, but we're trying our best to build bridges and confidence that vaccines are the answer to prevent disease.
Yeah, no, thank you. I think that's actually, unfortunately, that sort of surmises why we're in this situation at the moment with measles, is because over the last few years, I mean, that there has been a drop off in people actually taking up their offers to have their vaccines, and with MMR. Children will get invited for a vaccine when they're 1 year old, and then they'll get invited for their second vaccine when they are 3 years and 4 months old, and both of those are given through through general practice to children. And unfortunately, over the last couple of years, we've seen the numbers of people, whereas we used to have about 95% of our population would routinely turn up for both of those vaccines. Over the last couple of years, those numbers have dropped. And Emma, I know you've been following that and how much they've dropped. Do you just want to talk a little bit about where we're seeing, not necessarily naming places, but some of the sort of levels which we are seeing in some areas?
Yeah, sure. So I think the important message here really is that we know for population protection against measles that we need to have 95% coverage. That's for 2 doses of MMR uptake. And we know that areas, and we're not unusual in this, but are struggling, both in Cornwall and across England, are struggling now to reach that 95% coverage. And so we don't have the levels of protection that we need to protect against measles. And I think, it's stark that we're not reaching that. And I think it's a real reminder to people to be going out, to be getting their both doses of MMR to protect not only themselves but also those in the population that aren't able to have their vaccines, and I'm sure we'll come on to that later. But we know across Cornwall, there are different levels of coverage, and unfortunately some areas will be more vulnerable to measles. But the best thing we can do is go out, as I said, get our MMR and bring that coverage up so that we can protect ourselves and others.
Okay, so we've had some questions come in, which kind of show that our lots of people out there are quite interested in the measles and want to know more. And the first question which we've had is measles spreading quickly in Cornwall? And I can answer that for us now. And at the moment, we have had no confirmed cases of measles in Cornwall, which is great. And we're really fortunate because, as I say, in the West Midlands, in Birmingham, they've had over 250 cases. In London, they've had well over 150 cases. And we're now starting to see it kind of coming into other areas. in Bristol and I think it's Gloucestershire, they've started to see the odd case, but we know that once you get one case, you will always, with the level of vaccinations that we've got, you will always get spread. So we actually don't want to get any cases in Cornwall, because we know that we have got pockets of our population, and whether that's groups of people in towns or villages, or who go to school or who go to nursery, all you need in those settings is 1 or 2 or 3 people who haven't had their vaccines, and one person gets it and it will spread to everybody who's not vaccinated. So at the moment we've had no confirmed cases, but it's spread just by people being in close contact with one another. So if you happen to go up to Birmingham, for example, and stay with some family members, or if you happen to be, I don't know, working in a shop in St Ives and somebody from Birmingham comes in who does have measles, maybe they're not feeling unwell, they've got a bit of a rash, but they come on in and they're talking to you and they're in quite close contact with you. If you don't have both, if you're not double vaccinated, the likelihood is you will yourself then go down with measles. And so whilst we're fortunate today that we have no confirmed cases, we fear it's only a matter of time before we do get them. We've just had half term where we got an influx of people because Cornwall's such a fab place. We're coming up to Easter in 4 weeks' time. Everyone's going to come to Cornwall at Easter. Let's face it, nobody does an Easter egg hunt like we do in Cornwall. We've got the sea, we've got the sun, it's all wonderful. So we will get people coming from all over the rest of the country and also overseas, because we're seeing measles cases in a lot of European countries rise as well. And inevitably, if little Johnny's got measles but he's not feeling too bad, mum and dad are going to bring him on holiday, aren't they? Even though the advice will be for him not to come, they're going to bring him down, they're going to dose him up with some paracetamol, and then he's going to go touching people, seeing people, talking to people, playing with his cousins who live down here. And if you're not vaccinated, we will start to see cases. And once we start to see cases, it's actually really, really difficult to try and control. So no, we have no confirmed cases at the moment, but we actually fear that it is only a matter of time. Do you want to come in, John?
Yeah, just on the point around kind of how it's spread and the sort of how it's likely to come into the county, it's probably worth just pointing out that actually you don't have to have the rash in order to be infectious. So you can't, you start getting symptoms something like 10 to 15 days after you've come into contact with the virus. But actually, it may well be a day or two before you are unwell that you start to shed virus and therefore become kind of infectious. So actually, you can't necessarily tell, in the initial stages, if actually it is measles at all. And often it just starts out with the temperature, and there are so many other things that can cause a temperature. So it's really non-specific at the beginning, which is why the best way is definitely to make sure it doesn't get here, or that everyone is vaccinated, so that if it does get here, that we're all protected.
That's a really, really good point. Thank you, John. We've got a question in from one of our listeners, Judith. Thank you ever so much for asking this, because it's a really good question, Judith. You obviously heard me say that, we vaccinate children twice, once when they're 1 and once when they're 3 years and 4 months-ish. And your question is, are children aged 2 fully covered once they've had their first dose of the vaccine? And will that be enough to protect them until they get their second dose? Emma, do you want to answer that one? I'll start answering it and the rest of us will chip in.
Yeah, sure. Feel free to chip in. Judith, the first vaccine will provide a level of coverage. I can't give you the exact percentage, but it is significant protection. However, no one is fully protected until they have both doses. And so it's great. You've had your child vaccinated with their first dose, and now they will have to wait until their second dose, which will be given at 3 years and 4 months as an additional layer of protection for school. So unfortunately not, but we are encouraging everyone to go out and respond to their invitations to vaccination from their GPs, and to continue as currently offered via the current NHS schedule, which is at 12 months and 3 years and 4 months.
But it's worth saying there is a good level of coverage even from that first vaccine. And I guess what we're hoping for is that if if most of the population, so that 95, if we can hit that 95% of the population are covered, actually the chances of coming into contact with measles in the first place is very, it's quite limited. So it will still provide a good level of cover, and hopefully you won't come into contact with it.
Yeah, a lot of people sort of are asking that question about the timings, and just to give some reassurance, I mean, measles vaccines, MMR vaccines have been around for the last 40 years or so, and prior to them coming, there was an awful lot of work done to decide what is the best dosage schedule, when are they going to give best protection, and in fact, we'll come on to one of the questions about should 6-month-old babies get vaccinated. But actually, what all the research shows that if you give it at age 1, so to begin with, people will have babies will have natural immunity. Then by age 1, if you give the first dose, then that gives about 90% coverage and 90% protection. And then if you boost it again 2.5 years later, at 3 years and 4 months, that will then really protect you 100% from getting measles at any time for the rest of your life. And the timings of those are actually, they are the optimum timings. But if you've missed those timings, so you maybe have a 5-year-old, or you maybe have a 15-year-old who missed out, or even a 20-year-old who missed out, it is still absolutely right to go and get them vaccinated now. But we can't hurry that schedule. So we've had another question asked to us about somebody's baby hasn't had any MMR, which is absolutely right. Therefore, are they in danger of getting measles, and can their vaccination be brought forward? There is no policy and national guidance at the moment to suggest that we need to bring forward that vaccine schedule. And as John said, if everybody who's due to have a vaccine has been vaccinated, then we'll get something which is called herd immunity, which means really our population protects itself, because so many people are vaccinated that even if you have one person who does end up in the general world with measles, they won't come into contact with the unvaccinated children and people. So absolutely, if you get invited to have a measles vaccine, please do take up on that offer. And then Michele, this one's probably for you. Somebody's asking us about is it safe? Is the vaccine safe to have? Because they heard that in the 80s and early 90s, people were thinking that maybe it caused more harm than good. Do you have any sort of experience of that? If not, somebody else could pipe in.
All our vaccines are fully licensed, fully tested, and absolutely 100% safe to be administered. There is no, from the incidences from the 80s and the 90s, from the lower uptake and the links to autism, that's been totally unfounded. And absolutely 100% safe to give. Also, just to let people know, if you've had one vaccine and it's 20 years later, we would still give the second. We never would restart the course with giving a second lot. So it's just 2 doses in your lifetime to give you full coverage.
Okay, that's really interesting. And are there any side effects? Somebody else has asked about, when I have my flu vaccine, my arm goes a bit dead. Will it go a bit dead after an MMR as well?
Shouldn't go dead after an MMR, to be fair. Because it is a live vaccine, you can get the measles rash about 3 to 4 days afterwards, the German measles rash about 6 to 8 days afterwards, and then potentially the mumps side effects anything up to 3 weeks after the immunization.
Okay.
But like with anything, sorry, carry on.
I was going to say, will you feel ill with those, or will it just be a bit of a spotty rash?
Normally a bit of a spotty rash, but like I was supposed to say to parents, if they're uncertain, they can always seek medical advice.
Okay, John, did you want to come in then?
Yeah, well, I was just going to say, so those kind of side effects of the actual vaccine itself tend to be very mild, and compared to actual measles, are nothing. They're mild, they're over quickly, and you don't tend to get very unwell in comparison to what you're trying to protect against. So I guess the other bit just on that bit around our vaccine safe, the stuff that was around in the sort of 80s and 90s around, autism links has been totally discredited. So, it very quickly became apparent that wasn't, it was flawed research. But we've subsequently got another 20 years worth of, 30 years worth of data, which has shown that there is no link whatsoever. So, yeah, it is safe.
It is, I mean, it is as safe as houses. I totally agree with everything that anybody's saying. I've not read anything in the last, ever really, that gives any credibility to those concerns. So it's not one to worry about at all. It is one to absolutely go and get. So we've been asked by somebody, are adults who have not had a measles vaccine, will they get as poorly as a child if they get measles? Maybe that's one, John, you might be able to help answer.
So any adult who gets measles has got potential to be as poorly as the kids with measles, and those complications are still there. I mean, actually, there is some evidence that actually the complications can be a little bit worse in adults than they are in children. So, but I guess it's mostly the children that are more likely to get it because of their close proximity and the way they, interact with each other. So yes, adults can still get very unwell with it. Even so, if you're unsure about your vaccination status, you're concerned, just give your GP surgery a call. They will have all your records. They'll be able to kind of tell you where you are with it.
Okay, excellent. And one question we've had, which sort of you kind of go to, is can measles kill people? And the answer is yes. I mean, unfortunately, there have been reports of people dying because their initial infection was measles. It is certainly not unheard of. It is not common, but if you think that 1 in 5 children who get measles ends up in hospital, some of those will end up really quite seriously ill in hospital, which is, even if they don't end up dying, thankfully, an incredibly awful time for both the child and the parents and the family. So we do have to consider, all of these. So just because it might not kill you, although we can't guarantee that, it is still a really serious infection. And the problem is that people nowadays don't hear much about measles, but as I say, when I was a child 60 years ago, it was around, and you would hear in the street about somebody who'd got it. So just because we don't hear about it doesn't mean that it's not a really nasty infection. John, I think you were going to say something then. Sorry.
Yeah, so I was just going to say, so fortunately the risk of dying from measles is very low, but one of the other reasons we vaccinate and we try and get the that herd immunity that Ruth was talking about is that there are some long-term complications of measles as well. So you can get some deafness. You can actually get some brain damage from it as well if you get the encephalitis. There is a really, really rare condition that can happen many years after having measles as well, which is fortunately we very rarely see, but I guess one of the risks of seeing more cases would be that we would get more of those long-term complications. I mean, fortunately, most people who have measles get over it and don't have those rare complications, but that doesn't mean they don't exist. So.
Okay, thank you. So just to put things into context, and somebody's asking how many people may not be vaccinated in Cornwall. It's really difficult to give an absolute definite answer about that for so many reasons. One is, unfortunately, GP records may be slightly outdated. The information may be recorded in the wrong bit of the record and it might not be easily accessible. People of my age group, for example, can I remember whether I was vaccinated? I can remember having a spotty rash and I can remember feeling pretty lousy, so I probably had measles, but it's quite difficult to say. Our best guess is that around about 30,000 people in Cornwall may need to have their vaccinations, and that's an awful lot, really. That's about 5% of our population. So we do need to really consider that we have got. And a lot of those people will live in certain bits of Cornwall, in certain communities, and so we do need to all think about our measles, MMR status, whether we have been vaccinated or not, and then if you think not, then absolutely seek support from your local GP practice. So there's a lot of people who need to be speaking to their GPs. I'm sorry, John, about this, but it, there'll be less people who will be harmed and less pressures and less illness if you make a phone call today and check on your status. Emma, if I'm a mum and I can't remember whether I had my children vaccinated or not, where could I check apart from with my GP?
Your red book, if you took that along with you when you initially went for your children's immunisations, would have been recorded in there. So I'd say, first take a look at your red book. So that's what you have for 0 to 5-year-olds, and your child's immunisation should be recorded in there. If you're not sure, if it's not recorded, if you forgot to take it along with you, then do give your GP a call to check, and they'll be able to check your records for you. If, for example, you've moved from abroad, or you're born abroad, moved from abroad, and you're not sure what your vaccination history is, book an appointment and do go along for your GP, and they can look at that for you, and decide then the best pathway, because different countries often different vaccination schedules, and here would like to see everyone on the NHS schedule, and so they can review your vaccination history against that and then work out the pathway going forward. So lots of different ways to find out, but first go to your red book and then your GP practice.
And just say that you can also phone us, the school age immunisation service, because we've got access to child health records, so we can check immunisation status as well.
How would people get your number for the school age immunisation service? Can we put that somewhere? If we can put that on our website, brilliant. Yeah. Okay, well, we can sort that out with our communications team here later, and we'll make sure that the number for the school aged team is
email or phone in. That's absolutely fine.
Brilliant, excellent, thank you, that's brilliant, and I'm sure that's music to John's ears, because that might be at least a few of those 30,000 may go down the child information record instead of phoning their GP, which I'm sure will make him happy.
But we'd much rather have a phone call with some well people checking than unwell people who then need to see us. So
yeah, absolutely. Somebody says has asked, and I'll answer this one. What happens if my child does get measles, or if I get measles? What will you do? And so basically, if you find out that you've got measles, that will be confirmed measles by somebody taking a swab of your mouth and then doing just like the COVID swabs, and then we'll get that analysed. And if that comes back positive, then that would mean that you definitely have got measles. We'd ask you to isolate, stay at home for about 4 days. Hopefully after that, your rash will start to subside, you'll start to feel a lot better. But as well as doing that, there is a need for us to actually work out who you've been in contact with. So who you live with, who you play with, who you socialise with, who you work with. And any of those people who are not fully immunised themselves would then need to have something called immunoglobulin, which will then stop them producing the virus themselves. So it's really complicated. If you do get measles, there is a whole sequence of events with us. It's not me, it's the United Kingdom Health Security Agency, UK HSA, will do all of that case finding and all of that contact tracing, and will then try to make sure that all the people that you've been in contact with are protected, either because they've had the vaccine or because we can do something to protect them in addition to that. And you would be asked to stay at home for a minimum of 4 days while you were in your sort of contagious phase and have as little contact with people as possible. So that was just to sort of give you an understanding of what will happen if you do get measles. And that's apart from the fact that you're going to feel pretty lousy as well, covered in a rash, feeling snotty, earachy, eyes watering, generally unwell. So it's definitely one to avoid. And for people like me who work in public health every day and have absolute confidence in the vaccine, because I know that it is so safe for people to take, it's absolutely an avoidable illness that nobody needs to get. We were really close to having a measles eradicated totally from our population until people started to decide that they wouldn't take up the vaccine. So it is absolutely a vaccine preventable illness, and we really want to get back up to that stage where we have everybody protected so that people just don't feel unwell, because there's nothing as miserable as being poorly, and then also passing it on to your loved ones and friends is a horrible thing to do. The other thing to be, oh yes, sorry, Emma. Yep.
Oh, no, sorry, I just wanted to jump in there because you were mentioning how you'd have to stay at home for 4 days. I just thought it might be worth mentioning that if you're exposed to measles and you are yourself unvaccinated, or your child's exposed and they're unvaccinated, then there is a requirement then to stay at home and isolate for 21 days.
Right.
Which I think is really worth noting, because it would have a significant impact on education and work as well. It's difficult for people to be out of work for 21 days. So just worth noting that with measles, if you're exposed and you're unvaccinated, there is that requirement to stay at home for a longer period of time.
Yeah,
I had forgotten that, Emma, so thank you.
Yeah.
Sorry, John.
Well, I was just going to say that's particularly relevant for any healthcare workers, because if you come into contact with measles whilst you're at work and you're unvaccinated, you can't work for 3 weeks, and you have to kind of isolate during that time. So, yeah.
So I think the message out of all of this, and you'll all be really tired of hearing us say it, is check whether you've had your MMR vaccinations. If you haven't had 2 and you can't guarantee that, then speak to your GP and see what records they've got. And then if you need another vaccine, they will organise. John, do you mind giving people these catch-up vaccines?
Not at all, not at all. As I say, we'd much rather see well people and make sure the population is fit and healthy than see the potential illness that could spread really quickly if we don't vaccinate. So no, really happy to vaccinate people. Or have a conversation about what it means for you and kind of whether you've had it, whether you need it, any of those questions. Yeah, it's fine.
Because I think people are a little bit concerned about wasting GPs' time on this, because they know how busy everybody is. This isn't a waste of time, is it, John?
No, not at all. And actually, it probably won't be a GP themselves that will do it. It will probably be one of our nursing team that will run through it. And yes, we're all busy in general practice, but as I say, we'd much rather do this bit of work now than face consequences of not having done it.
Brilliant. Okay, thank you. Michele, do you want to somebody's asking about, has noticed that you mentioned that year 8s, you're going to start offering children in year 8 who haven't had it from the school-aged immunisation team. Can you just talk a little bit through how that will happen and how people will find out that they should be talking to you about this?
Yeah, we've been notified again through Child Health of these children that potentially may have not received their any MMRs or their second dose of MMR vaccine. So we are currently working through the list to make certain the records are accurate according to Child Health, and then we will be texting the parents to ask them to make contact with us, saying according to our records your child is overdue their immunisations, but again that may still be an error, so we need to discuss with them, check the red book like Emma said. And then we will discuss with them the immunisations, but we will be using a text service to invite the parents in to contact us and discuss. And then we will be doing catch-up clinics across the county at various venues, or we can also immunise them in schools, because we'll be contacting throughout the schools going to the schools until the end of the summer term.
Okay, that's really good. So I think if people are anything like me, when we get odd texts through, I always wonder whether it's a scam or not. So I think in this case, if you do receive a text saying that your child is overdue for their MMR and they could get it through the school aged IMS team, then please, it's not a scam, it's real and it's genuine, and do take action on it. Make the phone call and verify in your mind that it is legitimate, and then get them covered. That would be really great. We've had a question asking, is it spreading in other areas, measles? Because they haven't heard anything since the initial, it's in the Midlands. And I think the answer to that question is yes, measles is spreading. So it started with 2 epicentres really, which was London and the West Midlands, Birmingham essentially, in Birmingham. And that was sort of in January time, I think, was when it all first started to really kick off this time. And what we've noticed now is that the Birmingham cases have sort of spread across the West Midlands. So there's some in Worcester, there's some in Kidderminster, there's some in Nuneaton, there's some in Warwick. So they've spread out from the West Midlands, across the West Midlands, and are now really heading north. There's been a couple of cases in the northwest over the last week. And the London cases have, and I don't know whether it is them or whether it is the West Midlands cases, but they are starting to move down the country. As I say, in the top of the sort of the southwest area, there are now definitely a couple of cases that have been identified, and everybody's working frantically hard to try and contain it and stop it spreading into big clusters, because that's what we really don't want. Because what we know with measles is once you get a certain number of people who've got it, it just keeps spreading and spreading and spreading and spreading, and almost becomes sort of very hard to contain. And we really don't want to get to that position. So with that in mind, if anybody does have any concerns about themselves or their children, particularly if they are unvaccinated, if you are somebody who's been double vaccinated and you have a spotty rash, it is highly unlikely that is going to be measles. But if you are unvaccinated, or only you've had one vaccine, and you have the symptoms that John was talking about, which is that kind of general fever, the runny nose, the earache maybe, and then the spotty rash, which tends to cover the whole body quite quickly, the likelihood of, and if you've only had one vaccine or no vaccines, then that could definitely be measles. And if you're in that situation, our advice is to not turn up at a GP surgery, please, because we know it's so contagious, but phone ahead to the GP or phone ahead to a community pharmacy or a minor injuries and let them know that you're really concerned. Explain the situation, explain that you've got a child or yourself, you've never been vaccinated, you've maybe been in contact with somebody who you later realise has got measles, if that is the case, and you're now covered head to toe in a rash and you're feeling generally unwell. If you phone ahead and tell them that, they can then make arrangements to see you in a really safe way, do the swab and either confirm or otherwise that it is or isn't measles. John, do you want to come in there?
Yeah. So what you may find is if you come through to the surgery that we ask to send a photo in, because it just gives us an idea of whether it could be, whether it couldn't be, but also helps us to prepare when we do see you, to make sure we've got the proper PPE, that we're in the right room, and that we're keeping everyone safe. So yeah, you can either phone through to the surgery. Most surgeries have now got an online kind of consultation tool that you can also upload photos through. So it's worth having a look at surgery websites as well.
Okay, brilliant. We've had a really interesting question from somebody who says that they can't have products which contain any pork in them, and they know that means that they can't have certain vaccines. Does this mean they can't have the MMR vaccine? Emma, I know you know the answer to this one.
Yes, so that's fine. So if you don't want to have vaccines containing pork, then your GP is able to offer 2 MMR vaccines. Both are completely safe and will do the job. And one of those contains pork products and the other doesn't. So if you don't want to have pork containing vaccines, just talk to your GP about that and they can offer the right one to you.
Okay, and we have had a question from somebody actually about this issue, which says that if they really want to have a little bit more information about what's in the vaccine and what side effects it might and adverse effects it might cause, how would they obtain that kind of information? Is that a conversation with the surgery, John?
Yeah, it's certainly it's worth just having a conversation with surgery first. And as I say, whenever we give any vaccine, there'll be a whole kind of consent procedure to go through. So we'll let you know what the vaccine's all about, what's in it, what side effects are likely, those kind of things. And yeah, we can just make sure that it's the right thing for you and that you're fully informed before giving the vaccine.
Brilliant.
Yeah,
Michele, would that be something? Yeah.
Yeah, good. And just say all our consent forms actually have the link for the patient information leaflet on it, so the parents can actually read the information before giving consent, so it will be an informed consent.
Yeah,
excellent.
Is that worth sharing as you know, at the end of this as well, sharing that link to the information leaflet? Yeah.
Okay, well, we're getting some really good questions coming in now, which are making me think, do I know the right answer to these? So I'm just gonna answer it in what I know has happened elsewhere at the moment. Somebody said, if there is an outbreak in Cornwall, will people be able to take their child for their second dose earlier than 3 years and 4 months? And the answer to that is no, not at the moment. At the moment, the advice from the vaccine, the National Vaccine Group, is that the best and most long-lasting sort of protection against measles comes from having one vaccine when you're 1 year old and your second vaccine 3 years and 4 months old, and that there is no indication at the moment that those 1 year olds and 2 year olds and 3 year olds should have that second dose brought earlier, even if there is outbreaks in a particular area. So even in places like Birmingham and London, they haven't yet brought forward the second vaccines for people. So we will stick to what the national guidance says. We won't get an outbreak in Cornwall because I know that all those people who are concerned are now going to go and check whether or not they need their vaccines, and we're going to whiz right up very quickly to making sure that we've got everybody vaccinated. And on that, Emma, have we heard anybody talk nationally about vaccine shortages? Is there enough vaccine made to go around to everybody who needs it?
Yes, there is enough vaccine. We haven't heard anything through any of our meetings that, you know, there are any concerns about MMR vaccines. So we don't have to be worried about that. An MMR vaccine will be waiting for you if you need to go and get one.
Okay, brilliant. So just to reiterate, somebody's said, what should I do if I think a member of my family does have measles? So the first thing you should do if you think someone's got measles is make sure you've got all the information at hand. So what symptoms have they got, and what's their MMR, their vaccine status like, and have they been in contact with anybody known to have measles? Once you've got all those 3 bits of information, which will hopefully take you 2 minutes to assimilate, then phone your GP and have a conversation with the receptionists. I'm sure that in all our surgeries, they're waiting for these calls now, because that's what we're expecting. So phone your GP, explain what the situation is, and then take the action that they recommend, because they will be able to do a very quick risk assessment and decide whether this needs further investigations. As John said, they might ask you to take a photo of the rash if it is a rash, and be able to give you advice from there, or they might just be able to give you advice from what you're telling them. But do make sure that you know what the vaccination status of that person is, and also whether they are likely to have been in contact. So if anyone's been on holiday anywhere, whether that's in the country or outside of the country, if you've had any overnight guests, if they know of anybody in their school environment or their college environment or their work environment who've got similar symptoms, all of that information will really help your GP make the right judgment call as to what the next steps are. Please don't turn up at the surgery with somebody covered in a rash, though, because that could cause much more harm. John, do you want to come in there?
Yeah, I was just on that note. I was also going to say, please don't turn up to the emergency department either, because they don't have the facilities to isolate people in the same way that we do in surgeries. Plus, they've also got, you know, big waiting rooms full of people who actually there's a risk of spread if it is measles. So yeah, GP surgery, first port of call by a phone call. If the GP surgeries are closed and you're worried about either a relative or a child or something, then 111 will be able to put you through to the out of hours GP services.
Brilliant. Okay. Well, thank you, Emma, Michele, and John. Have you got any last messages that you want to pass over to anybody who happens to be listening? Or anything that you don't think we've covered? Emma, go for it. You opened your mouth, so now you've got to say something.
Well, it's just to reiterate, we've said it lots of times, but that it's never too late to get your MMR vaccine. As everyone said, measles isn't just an illness that children get. You can get it at any point during your life if you haven't had both doses of MMR. And if you're unsure about your vaccination status, contact your GP and they'll be able to tell you.
Brilliant. Anything from John or Michele? You're both nodding, so you obviously agree with Emma, which is great. Any other final messages, or I think we've dealt with all the questions?
No, just reiterate that and reiterate the point that we're very happy to give any advice on your vaccine status, talk through vaccines if you're concerned about it, or give vaccines, and we're really happy to do that. So yeah, please get in contact.
Brilliant. And Michele, you're going to post for us your email for the school-aged IMS team and a contact number so that people can make contact, so that you can then help check out their childhood immunisation status. Fantastic. Thank you, everybody. That was a really good and informative I hope, Facebook Live episode. And please don't be shy now. No one's going to shout at you for turning up and saying, can you let me know whether I need to have a measles vaccine? We will all be delighted to hear from you and get you vaccinated as quickly as possible if necessary. So thanks, everybody. And go get vaccinated if you need it.